I'll never forget the first time I had blood work. I was sitting beside the nurse, holding my mother's hand and sobbing. Despite her reassurance, I was paralyzed with fear of the forthcoming pain. My current research explores this moment and the social interaction that occurs as a result of it. This summer, I collaborated with 2 PhD students as they conducted a randomized controlled trial and multi-method investigation into parent-child interactions during child venipuncture. Painful needle procedures are a natural part of development, but can elicit pain, fear, and distress in parents and children alike. These negative consequences have short and long-term implications. In the short term, it can lead to longer procedure times, risk of injury from fainting, or the use of physical restraint. In the long term, it can lead to increased pain at future procedures, avoidance of healthcare in adulthood, or even immunization non-compliance. This can increase the risk of vaccine-preventable diseases, thereby becoming both an individual and a public health concern. Since caregiver behavior influences variability in child pain and fear outcomes, my work at the Pediatric Pain, Health, and Communication Lab explores the interpersonal interactions that occur in this context. There is widespread consensus that parent behaviors influence child pain and fear outcomes, but the underlying mechanisms are largely unknown. These mechanisms could inform interventions that reduce child pain and fear and parent distress. This study is the first to offer a mindfulness intervention to both parents and children to help manage distress during child venipuncture. It also takes a closer look at the factors that influence parent behavior. To investigate this, children between the ages of 7 and 12 and one accompanying parent were recruited from an outpatient blood lab at McMaster Children's Hospital. The original sample size was 150 dyads. Of these 150 dyads, half would undergo blinded, randomized allocation to the mindfulness condition. The other half would have been allocated to an unfocused attention task, which served as a positive control. Unfortunately, due to COVID-19, recruitment was halted at a sample size of 61 dyads. Constructs were evaluated using psychological, physiological, and behavioral measures. Those shown in this table are primarily psychological. However, observational coding was used to empirically investigate parent behavior. Interactions between parents, nurses, and children were video and audio recorded and transcribed. These transcripts will be coded into coping promoting, distress promoting, and neutral parent behaviors. By investigating the relationships between psychological, physiological, and behavioral variables, we can nuance our understanding of the factors that contribute to parent behavior during their child's venipuncture. So why is this important? Well, the mindfulness intervention could have clinically relevant effects. After data analysis, we'll be one step closer to developing an intervention that reduces child pain and fear and parent distress. Of course, we seek to expand the literature by addressing gaps in the current knowledge. Through continued research, we hope to improve what represents a critical interaction between children and the medical system. Thank you for listening to my presentation. I'd also like to thank Rachel, Caitlin, and Dr. McMurtry for making my research experience so positive.